Comprehensive, relevant, and insightful conversations about health and medicine happen here on MedStar Health DocTalk. Real conversations with physician experts from around the largest healthcare system in the Maryland, D.C. region. Welcome to MedStar Health DocTalk. I'm Ryan Miller, and I'll be your host for today's episode. I'm joined by Dr. Jennifer Kanakry, a hematologist specializing in cellular therapies for blood cancers, including allogenic cell transplantation, autologous stem cell transplantation, and CAR T-cell therapy. She is the medical director of the Stem Cell Transplant and Cellular Immunotherapy program at MedStar Georgetown University Hospital. Dr. Kanakry, thank you for joining us on MedStar Health DocTalk.
Thanks for having me.
Start at a real entry level. What is CAR T-cell therapy?
CAR T-cell therapy is a way of taking T-cells from a patient's body, sending them off to be engineered to have a receptor that targets the cancer, and then reinfusing them back into the patient to hopefully put their cancer into a deep remission or even a cure.
That's incredible. So roughly you're using someone's own immune cells to fight their cancer.
Yes, exactly.
That's incredible. Every time I hear you guys talk about it, I'm just blown away by this treatment option. Dr. Kanakry, what can you treat with CAR T-cell therapy?
We have CAR T-cells for a whole range of B-cell lymphomas, as well as some B-cell leukemias like acute lymphoblastic leukemia and multiple myeloma.
What should a patient expect when they are treated with CAR T-cell therapy? Can you walk us through the process here?
When patients come to a cell therapy center to talk about CAR T-cell therapy, it is a process that they embark upon with a knowledgeable cell therapy team that will guide them through every step of that process. But it does involve first making sure they're a good candidate, that their blood cancer is the right type to be targeted by CAR T-cells, that they're at the right point in their treatment journey to get CAR T-cells. And then we have to collect the CAR T-cells, send the CAR T-cells off to the company, and then receive them back to treat the patient. So this can span several weeks, if not months, from the time we first meet a patient and talk about CAR T-cells to the patient actually getting the CAR T-cells.
What types of lymphoma, I think you touched on it earlier, but can you just walk us through those again? What types of lymphoma can be treated with CAR T-cell therapy?
The vast majority of lymphomas that patients get in the United States can be treated with CAR T-cell therapy because 85% of all lymphomas are B-cell lymphomas, not T-cell lymphomas. And B-cell lymphomas are the lymphomas that are targeted by CAR T-cell therapy that targets CD19. CD19 is virtually on every B cell in the body, from the beginning of B cell development to very mature B cells. And so whether patients have diffuse large B cell lymphoma, or marginal zone lymphoma, or mantle cell lymphoma, or acute lymphoblastic leukemia, those are all B cells causing a blood cancer that can be targeted with CAR T-cell therapy.
Can you walk it back a little bit and just explain what is B-cell lymphoma? I guess it is pretty common. You said roughly 85% of lymphoma cases are indeed B-cell.
Correct. So 85% of all lymphomas are come out of the B cells of the immune system. And then lymphoma is actually the most common blood cancer as well. And so the majority of patients who face a blood cancer are facing a B-cell lymphoma who can be potential targets for CAR T-cell therapy.
Is this therapy only an option after other treatments have failed?
At present time, CAR T-cell therapy is for patients in the second line or beyond setting, meaning patients who have gotten the first therapy recommended for their type of blood cancer, and then either had no response, what we call refractory disease, or relapse after some period of time. And so it's not currently being used when you're first diagnosed with a B-cell lymphoma, but as a next step, should that lymphoma come back or not respond well to the first therapy.
Is the hope that down the road someday it will be a first option?
I think with time, we will see CAR T-cell therapy move earlier and earlier into the treatment of patients with B-cell lymphomas. where even now here at Georgetown, we are participating in a clinical trial that takes patients who are diagnosed with diffuse large B-cell lymphoma the majority of whom we think we actually cure with first-line chemotherapy, but being able to look at the end of that chemotherapy with highly, highly sensitive techniques to look for any lymphoma cell left in their body. And if they have a bit of lymphoma left behind that the PET scans can't show and that their blood work can't show, they can enroll on a clinical trial to receive CAR T-cell therapy at the end of their first-line chemotherapy to try to nail down that cure that we're hoping to get in the first time around.
Just to be triple sure, I like that. Explain the different kinds of B-cell lymphomas and how treatable are they?
There are many types of B-cell lymphomas. The most common is called diffuse large B-cell lymphoma. And that is a very fast-growing, aggressive lymphoma that typically does need treatment very quickly. It also is a type of lymphoma that patients who are initially diagnosed with lower-grade lymphomas, like follicular lymphoma or chronic lymphocytic leukemia, may actually have their lymphoma change in its characteristics and become more aggressive and become diffuse large B-cell lymphoma. And those patients do often qualify for CAR T-cell therapy in that setting of transformation or change from a less aggressive lymphoma to a more aggressive lymphoma. There are also times that lymphoma can involve the nervous system, central nervous system like the brain, the spinal cord, and the fluid around the brain. And CAR T-cell therapy is an option not only for times when the lymphoma as a second step goes to the brain, but now very recently the FDA has approved the use of CAR T cells in what we call primary central nervous system lymphoma, when people are diagnosed with lymphoma only in the brain. And that is a recent change just in the last couple weeks.
Dr. Kanakry, what kind of research are you involved in?
I am involved in clinical trials that are either initiated here at the university or from the drug companies, looking at ways to meet holes in how we apply CAR T-cell to blood cancers. So we have a current ongoing study trying to move CAR T-cell therapy earlier to consolidate responses after first-line treatment for diffuse large B-cell lymphoma. That is a cool study because it's also what we call off the shelf. It's CARs that are made from the T-cells of other people, not from the patient. So we can identify a patient who needs the CAR T-cell therapy and within a matter of days instead of weeks, be giving that CAR T-cell therapy, literally like pulling it off a shelf and giving it to the patient. And that's another huge area of how can we make CAR T-cell therapy faster.
And still safe, right?
Still safe, still effective, able to reach more patients. What if a patient's T cells aren't good? What if a patient's T cells don't manufacture well and aren't ready for them when they need them? The future research in CAR T-cell therapy focuses a lot on how to make it faster, better access, less barriers, and a good product for any patient who might need CAR T-cells.
Really interesting. And do you know what phase that might be in?
Many of those are still early phase, although there are already good data that it is safe. So then the next step is to show that it's effective. And so that's when we get into phase 2 and then phase 3 studies. And the one that we have ongoing at Georgetown, because there are good safety data already, is actually a randomized study.
You sound really optimistic about the future of CAR T-cell therapy treatment. Is that safe to say?
It is safe to say that I'm very optimistic about CAR T-cell therapy. We have made many strides just in the last decade of CAR T-cell therapy, taking the initial targets, CD19 and BCMA, to target B-cell lymphomas and multiple myeloma, and really extending the number of patients that can be treated. And I think next is finding more targets, combining targets, making the manufacturing faster and more effective, and always focusing on decreasing the toxicities. Another thing that I find very important is that this is all really medically complex. Right? You have to collect the T cells, you have to manufacture them, give them back to the patient, and really just focusing as we deliver the clinical care to patients, whether it's through research or standard of care, is breaking down the barriers that make CAR T-cell therapy seem really overwhelming or really complicated, and taking the patients through step by step, walking them through what is a very unfamiliar process for them with the help of our knowledgeable cell therapy team.
They're lucky to have you and your great team for sure. That does lead me to a question I had. What's like a common question that you get from patients, or is there a question you wish patients would ask you?
I think what I generally see and expect is that patients really don't even have a great concept, understandably, about what CAR T-cell therapy is and what it entails and what it means to get CAR T-cell therapy. Most don't even understand that we have to collect the T cells from them and we send them off in a bag and get them back and reinfuse them. And so we use a lot of education materials. We have pictures and diagrams of how they actually get hooked up to the collection machine, the apheresis machine, how that happens. We show them calendars to kind of walk them through the timeline of this is when we'll collect your cells and this is when we expect them back. Otherwise, it's hard to just in words leave with a good understanding of what's going to happen, and find that the pictures really help, all the education materials, and then our cell therapy coordinator nurses who really remain the point person all along the way for the patients to figure out their plan of care, talk with when they have questions, and then always, of course, have access to us as the cell therapy doctors too.
That's a really important role that they play then too, huh?
It's a critical role.
How new is this again, CAR T-cell therapy for lymphoma?
CAR T-cell therapy really is just in less than the last decade, where the early clinical trials were reaching approval in the late 20-teens. And here at Georgetown, we started giving CAR T-cells in 2018, which is similar for most academic hospital settings. So relatively new when you think about it. And the exciting thing about that I also tell patients when they ask me, well, how am I going to do? Is this going to lead to a long-term response? Is this going to lead to a cure? What I tell them is we don't know for sure actually how many patients we're going to cure, because when we look at the patients that were first treated and the additional many tens of thousands that have now been treated, there are some that just keep on going and going and going who have not yet relapsed. And so time will tell really how many patients we're able to cure with CAR T-cell therapy, because there's a lot of people out there.
Right. And it's exciting that you guys have made these kind of advancements in the short time that it's been available to patients.
It's really amazing to see, and we learn more every year about the long-term outcomes of CAR T-cell therapy. This is something that is tracked in a central registry as well, and so patients consent to have their information tracked, and then we can look as a field across every patient treated with CAR T-cell therapy across the country, across the world even, and then look and see what is the survival outcomes of patients with certain types of lymphoma in, again, now like thousands of patients.
Do patients find our program and yourself on their own, or are they often referred to you?
Patients are typically referred by their doctor, who identifies, often at the time of finding relapse disease, a PET scan that shows that the lymphoma has come back, a biopsy that proves the lymphoma comes back, which is a very scary time for a patient. And that doctor may not have access to CAR T-cell therapy. So at that point, they need to not only break this news to the patient, but then refer them to a whole new team. And that must be very hard and scary for a patient. But I think the referring doctors typically frame it as this is the best next step. And then we get patients in very quickly to start talking to them about the process to try to knowledge can get rid of a lot of the anxiety. It's the unknown.
Yeah.
It's worse than at least having a plan for many patients. And so we try to respond very quickly to referring doctors' requests to see patients for CAR T-cell therapy.
When I stop by the clinic, you guys seem really busy up there.
We're always very busy.
Just a few more questions. I'm really enjoying this conversation. Thank you so much for your time. What led you into stem cell immunotherapy?
I, as a hematologist, have always gravitated towards the blood cancers within hematology, and then did my training at hospitals where, at the time, stem cell transplant was the cell therapy that was given. CAR T-cell therapy was not around yet. It was in the research setting still, but not an approved therapy. And I fell in love with the ability to use cells, to use living drugs or living medicine to help a patient have a potential cure for their cancer. And there's something very special about being able to give someone in the face of really bad news about a blood cancer a hope of long-term response or even cure. And it's that sort of intensity and hope that I found very attractive, first to transplant and then just as exciting in the setting of CAR T-cell therapy.
Your patients are lucky. You ended up in stem cell for sure. Last question for you, Dr. Kanakry. During our conversation, you've laid out a number of reasons, but could you just reiterate why should patients choose a stem cell transplant and cellular immunotherapy program for their care?
Patients should come to a knowledgeable center if they need cell therapy, and the stem cell transplant and cellular immunotherapy at Georgetown treats many dozens of patients a year across autologous transplant, allogeneic transplant, and CAR T-cell therapy. So a really knowledgeable team, multidisciplinary team that includes doctors, nurses, advanced practice providers, a clinical pharmacy specialist that is integrated into our daily rounds, a dietitian, social worker, case manager, as well as all of the ancillary staff to keep people physically strong, and physical therapy and occupational therapy and all the other moving parts that are necessary to get people safely and optimally through cell therapy.
Well, you guys do a terrific job, and you have your patients covered in every aspect, so kudos to you. I've been speaking with Dr. Jennifer Kanakry at MedStar Georgetown University Hospital in Washington, D.C. Thank you so much for sharing your expertise with us today on MedStar Health DocTalk.
It was my pleasure. Thank you.
For more information on CAR T-cell therapy, call 202-993-0492.